Hey, welcome to another edition of EdTalks. This is so much fun because it's one of my besties, Dr. Matt Lambert. Matt, welcome to EdTalks.
Hello, Ed. I can't believe it's taken me this long to be on Ed Talks. Couldn't be happier to be here, and it's great to see you. Great to see you.
I know, but you were one of the first ever on Digital Voices, so I will find that episode and put it in the links. People should definitely listen to it because you have such a broad expertise, not just on the provider side as a doc, but also on the payer side. And that's what makes you like kind of unique, but even more unique and better as a human. You're a well-rounded human, an author. You're like what do you call it? A Renaissance guy, author, musician, doctor, everything. So tell us a little bit about yourself.
Well, I'm just trying to aspire to be like you. Coming to you from DC today. Yes, enjoy as always. Don't have any music with me, but really excited about taking a new role with Advantmed, the as the chief medical officer and head of product strategy. And so that's been a really exciting time over the last couple of weeks to ease into that. But otherwise, enjoying or surviving, I guess, a pretty grueling winter here in the Northeast. I don't know if you guys have had anything in Texas, but we've had a lot of winter, had a lot of skiing. But now it's kind of focusing on a new role and a little bit of a different role. It's a little bit less tech and more operational, even more clinical. I'm going to be running. Advantmed has a large coding and retrieval services, but my first task is to help grow their IHA business, so their in-home assessment business. And that means we have a team of nurse practitioners who go out and see members who've maybe gotten caught in the wash somewhere or lost contact with their plan. And so the nurse practitioners will go out, do a in-home assessment, a med rec, physical exam, close some quality gaps, make sure they've accurately captured the disease burden, do follow-up when needed, reconnect them to primary care, also care management if needed. So it's kind of a unique spin coming back to a little bit more of the clinical side of it. I
Yeah.
thought of Akash Patel, the CEO, has been running this for 20 years and just a great immigrant story. Need to connect him with Sim at some point. So I'm sure they could tell some stories about their journeys as well. So that's it. Busy as always. It's funny. I'm going to switch around a little bit here. I was checking our text messages the last time that you texted me, said, "Hey, are you in DC?" And I said, "No, I was actually in Hawaii." And I was in Hawaii for work, and you scolded me for not inviting you. And I can tell you, I'm going up to Boston tomorrow for some meetings, but I will not be attending in my Aloha shirt or my flip flops like I did there. That's a pretty good way to do business. Pretty good.
Yeah, yeah. I definitely envy that. Yeah. And for those who don't know, we go way back to 2015, where we both showed up very naively at New York City Health and Hospitals. We loved it. Nothing negative. It was
No,
an amazing, amazing experience in many different facets, but that's how we first met up. I was CIO, you were CMIO. We had a ragtag, our ruffians with us, and we pulled off perhaps the greatest implementation ever in the world, I would say, given the politics and the enormity of a $1 billion install. But that was so much fun. And we became fast friends, and you were actually a member of my wedding party, which I'm always thankful for.
absolutely, absolutely. I think about those days all the time. There's so many, sometimes making advances in healthcare, whether they be on the payer side, provider side, or in technology, so iterative, right?
Yeah.
And when the mayor of New York City's reelection is involved in your Epic implementation, it certainly complicates it, but we were able to move quicker in some ways that we never would have. So yeah, what a time. What a time.
Yeah.
And
We're all
that's
still
10 years
fast.
ago, Ed. That's 10
I
years ago.
know.
Yeah.
We're all still, yeah, over 10 years ago,
Yeah.
all still fast friends and things like that. And one thing I really appreciated too, and which makes you sort of unique in not only the roles that you take, but as a person, is you are a musician, as we mentioned. And so we would have you play. And then I think even fast forward into the times of COVID, you and I served together again with Tech Mahindra. And it was kind of a difficult time for everyone. We were working through some difficult projects with a specific client, a big health system in the Midwest. And I remember one thing we did, it was 7 a.m. Friday meetings. That was brutal. I don't know who came up with 7 a.m. Friday meetings, but we'd always start off with you playing guitar. And it kind of get to set the nice tone.
Still kick myself because one morning the CEO asked for some Zeppelin, and all I could come up with was some Hendrix. So, I thought that was a reasonable trade, but that was Purple Haze was all I could come up with on the spot like that.
Not even Stairway to Heaven or something.
No, and I talked to Rachel the other day too. She was so much fun
Yeah.
in that project. And just, The way we're spinning up RPM during COVID, sometimes over the weekend for that. I think that was really crazy work, but really rewarding work to help, offload all that stuff.
Yeah, and so now you're basically continuing that with tell us, one other snippet about your new role where you really are taking healthcare to the home.
Yep, absolutely. And I am old enough to have done some house calls early in my career, and really learned the value of being in the home. I mean, you can learn so much about someone by being in their home. But so yes, our nurse practitioners will go to the home, do their assessment, leverage some portable technology, their diagnostic technology when it comes to maybe hemoglobin A1C or a retina scan. And then they also have their own internal technology to kind of help support the visit, and a pre-visit review done by a clinician before, so that nurse practitioner can really focus on the person there in front of them. So it's a really well-oiled machine. My job, I think, is just to kind of take it to the next level.
Yeah, they're really lucky to have you. I look forward to the day, Matt, that you and I get to serve together. We've been able to do that a couple of times, and it's always been very rewarding. So, Matt, thanks so much for being a guest on Ed Talks.
Thank you so much for having me, Ed. It's been too long. Already looking forward to the next time.